Hello, my name is Carma Matti-Jackson. I am the President and CEO of Washington Healthcare Association here in Washington State. We represent skilled nursing facilities and assisted living, and we advocate on behalf of the workers and the residents and the providers. Today, I wanted to give you a brief report on Governor Ferguson's release of the 2026 supplemental budget. In terms of scoring for this budget, I'm giving it 2 D's and an F, and that is being generous. This budget cuts $147 million in Medicaid for our seniors. To say that I'm confused by this budget is an absolute understatement. The first grade that Governor Ferguson is getting is a D for being disingenuous. Only months ago, he stood shoulder to shoulder with our providers on our providers' campuses, and together we jointly opposed federal Medicaid cuts. Here we are months later, December 23rd, and the governor releases his budget with $147 million in Medicaid cuts targeting our seniors. The next D that the governor's getting from me is a D for destabilization. Somebody needs to sharpen his pencil because this math just does not work. We know that Medicaid funding today is underpaying our wages for our workers, RNs, LPNs, other workers by up to $13 an hour in assisted living and skilled nursing facilities. For our certified nurse assistants, Medicaid pays $19.83 an hour, which is less than the minimum wage in Seattle. And it's far less than the average wages or the highest wages that are being paid to our NACs today. Under this budget, residents face greater staff shortages, access to care gets reduced, and when Medicaid doesn't pay, everyone else has to. Somewhere, Medicaid has to be subsidized in order to keep access open. And finally, this budget gets an F. It gets an F for failing our seniors. We have 46,600 individuals being released out of hospitals every year into skilled nursing facilities. Where will these people go if access shuts down? We have 8,000 seniors on Medicaid that are being saved from homelessness by living in assisted living. In addition, we know that our state has one of the highest ratios in the nation for the number of 85-year-olds to the number of skilled nursing facilities. And finally, we know that our state's 85 and older population is quadrupling over the next few years. Our state is in no way prepared for what's to come. We need policies and Medicaid funding that would genuinely help avert the destabilization of a system that is such a critical part of the healthcare continuum. I'm asking you to engage today. Tell your legislators not to accept the governor's proposal of $147 million in Medicaid cuts to seniors. Thank you.